Hello everyone, I'm Adina, the patient care coordinator here at Cheng Plastic Surgery, and we are going to go over upper eyelid surgery and post-operative instructions for that. You may have had an upper eyelid surgery recently or considering that and just want a little more information how to take care of yourself post-surgery. I do take care of a lot of our patients post-surgically for 1 or 2 days. So this is what I would recommend. And then of course, we're always available to answer any questions for you, but we thought that these videos would be helpful and informative for you. Lindsay is our model today, and we're just showing an example of upper eyelid surgery. So typically for us, the eyelid incision is right at the crease, depending on, again, what the patient's desires are. In some cases, it's going to be a full incision. In other cases, it may be a non-incisional where we have 1 or 2 sutures creating a crease. That again will be dependent on what the surgeon decides to do for you. But in this case, Lindsay has had upper eyelid surgery, incision would be here. And so Q-tips, hydrogen peroxide, erythromycin, that's going to be the ointment that you're going to pick up from the pharmacy. And then we have you pick up a nighttime ointment along with a daytime refresh tears. Because typically what will happen post-surgically is the most common thing that you will be experiencing is dry eye. So we want to stay ahead of that and making sure that those eyes stay lubricated. So simply what you're going to do is clean 4 times a day. Best way to schedule that out is think of it as breakfast, lunch, dinner, bedtime. Set everything up for yourself either in your restroom or in your bathroom vanity, and then you want to just make sure that those supplies are ready for you so that way when you wake up, you go and you do your cleaning. So with the hydrogen peroxide, you're going to go ahead and dip your Q-tip inside, and then you're going to follow that just along the lash line here. And then what I like to do is I like to take a dry Q-tip and then mop that up so that way when you go to put your ointment on, you're putting it on a dry incision. Super important. So the erythromycin would go on, you put that there, and then you're just going to follow along the crease here. And then after that, you're going to have bruising creams that you use that can be put on throughout the day, and you can't overdo it. But the most important thing after that is going to be icing. So you're basically going to place the gel pad or the P's over the eyes. You're going to sleep elevated. Just think head above your heart. So you don't want to sleep flat because that will cause more swelling. One important thing to remember with surgery is that the majority of your swelling is actually at day 2 and 3. So initially your surgery day is considered day 0. And then the following day is day 1. And then by 2 and 3, you're going to max out on your swelling. And then from there, you'll continue to improve. Now, you're going to be swollen for some time, but I think that in most cases, you're going to be good and ready to be around people at anywhere from 7 to 10 days. Common issues that may arise when you have upper eyelid surgery, of course, is bruising and swelling. That's the most common, and dry eye. Always plan for bruising and swelling and then be pleasantly surprised if it's less than you anticipated. We encourage fresh pineapple, fresh papaya. There's enzymes in there that will help as well. But again, you're using vitamin Ks, arnicas, bromelains, things like that that are going to help with that. We will prescribe or actually give you Enhance that's going to help with your bruising and your swelling. Most common questions that will arise or that patients will reach out to me about is, when can I go back to work? So I think for most patients, a week. Now with the luxury of course, working from home, honestly, I think you're going to be ready a few days after. We don't want you laid up. This is definitely not a procedure that you're going to be in bed for a week. You know, the first night probably is the most uncomfortable, but most patients are honestly taking Tylenol for any discomfort that they feel, if anything. Making sure that your eyes stay lubricated, especially if you're going to be reading or on your phone or especially computer work. So in a perfect world, I think you would give yourself a week, but 3 to 4 days after, I think you'll be pretty comfortable going back, making sure that you're just using those ointments and drops throughout the day just to avoid dry eye. Also, when will sutures come out? Sutures will come out dependent on your actual procedure and technique that the surgeon does. So for us, it can be anywhere from 4 to 6 days, depending on, again, what technique doctor's done, but we'll go over that specifically with you. We like to have eyes on you that first week, more also just as moral support as well, and just making sure that you're healing, because I think having someone around to just be your little cheerleader, that's our job, and we'll make sure that you are not alone in this journey. But making sure that your incision stays nice and clean, and ointment with ointment is really important. So if you are considering upper eyelid surgery or you have had it, these are the things that will help you. Again, hydrogen peroxide on the incision, and you're just taking Q-tips, and then you're going to apply your erythromycin after that. You're going to apply your ointments or drops inside of the eyes, and then you're going to ice and sleep elevated. That's really important to just stay on top of your cleaning and your icing, and your healing will just come along, and you'll be pleasantly surprised at how easy it is to actually recover from the procedure. That is pretty much upper eyelid surgery post-care. Always reach out to us if you have any questions, but I think you're going to do great.